Okay, so next we're going to talk about how to treat necks. APTA has supported the use of laser for treating a couple different categories of neck pain. So you're certainly supported in the literature if you're deciding to make the clinical decision to use the laser to help your patients that are having trouble with their neck. So the first thing you're going to have to do is calculate the area that you're going to treat. For most patients, just treated unilaterally for one side of their neck is roughly 200 centimeters squared. So if you think about a claw grip is 100 centimeters squared and you map that out, that's roughly two hand widths of area. That's where I come up with the 200 centimeters squared. If you wanted to come down further into the upper trap or come into the rhomboid, if you thought these were all areas, you would just have to include those into your calculation. Given the nature of the neck and that a lot of the muscles are reciprocal and the way that the nervous system is so complex, it's strongly recommended that you try to treat both sides when you're treating any neck pathology. It's just going to make it easier to get a better result. So even if you're really convinced the problem's on the left, not a bad idea to just do both sides just to make the treatment that much more effective. With 400 centimeters squared and having a unit that has 15 to 25 or even 40 watts of power, it'll be very easy to incorporate that extra area into a treatment session. So in this case, we'll pretend that our patient has a lower cervical facet issue, some arthritis, and so we're going to try to incorporate treatment to the lower cervical aspect of her neck. So we'll call that 200 centimeters squared to get roughly from the mid-cervical down into the C7, T1 area. So if you use your perfect protocol to figure that out, this is your operations screen. You hit your perfect protocol button. Area would be 200 centimeters squared. For power in the neck, you want to use higher powers because we're generally treating with deeper tissues. So in this case, we have a 15 watt maximum on our FXI. I would use the full 15 watts. If you have one of our 25 or 40 watt units, you'd probably want to be starting in the 20 to 25 watt range and seeing how the patient responds, and then moving north depending on what effect you're having. The goal is to try to get the best outcome you can with as little power as necessary. So if you were to be treating at 20 watts of power and you had a thin patient like I have here today and you got a great result, you might just want to keep it right there at that setting because you're getting the result you're looking for and the dose is obviously appropriate. So don't think always more is going to be better. You're just trying to really get a sense of how the patient's responding and the symptoms based on the dose that you've chosen. So in this case, we're going to go with the 15 watts. For dose, you're going to be in the ballpark of 10 to 15 joules per centimeter squared for necks. So in this case, we would choose 15. She's not acute. And that's going to take me 3 minutes and 20 seconds to deliver about 3,000 joules of energy to her neck. Strongly recommend when you're dealing with anything in the neck or back to use an on-contact application. Our patented massage ball is awesome for this. It's going to allow you to get some compression and make sure that you get the most efficient light being transferred into those deeper structures. When you're dealing with things that are more superficial, if you go off contact, you're not going to pay much of a price for that. But when you're trying to get several centimeters of depth with your treatment, the massage ball is going to be a great choice. So the way that treatment's going to look is we're just going to try to paint that tissue, moving it roughly 2 centimeters per second. And like I was saying earlier, we're going to try to treat bilaterally, just to incorporate all those segments, all those nerve levels from the mid-cervical area down into C7. So this would be an example of, say, a C5 or a C6 pathology that you were trying to address. No problems going over the midline. If they had any kind of hardware from a fusion in the neck, that would also not be a problem. You could treat right over that. The key is just to keep things moving. How's that feeling? Okay. After about halfway through the treatment, if you can try to incorporate some active motion, that's desirable. So if you can have your patient just gently turn, left and right as you're treating, that would be desirable. That's just going to get some motion in these tissues. It's going to get some motion at the facets, which, as we know, is good for helping with pain. And what you may find is that as the treatment's going along and you're possibly blocking some pain, they might pick up some range. And that's always a positive thing as well, because it helps the patient know that what you're doing is helping them move better. It is important to make sure that the motion is pain-free. We're trying to lower people's pain levels, and if you're constantly bumping into a painful end range, that's not going to help what you're trying to do. So whether it's passive or active range of the neck, just make sure that it's not hurting the patient, that they feel comfortable, and if they can increase as they're doing the treatment, that's great. But that's really not where you want to push things aggressively for that reason. So, in review, just make sure that you're mapping out the area that you're going to treat. Certain conditions are going to take very small amounts of area. Other ones, if it was say an upper trap issue, might have quite a bit of area, 1, 2, 3, 400 centimeters square, which would be double the area that we just did. Just make sure you're actively accounting for all the area that you're going to treat. A common treatment area is that people will account for say 200 centimeters squared, and then as they start to treat, they start to wander into other areas, and that's a problem because that's going to significantly dilute the dose that you've calculated. So stay very disciplined in staying in the area that you've estimated when you do your treatment. That will help you get much better outcomes. In this case, if you were going to treat in the mid-back, obviously you'd have to expose that skin so that you could treat that. You never want to treat over top of clothing or dressings, anything of that nature. So you have to be skin-on-skin contact. Other than that, I think you're going to find that the laser is going to really help these patients. So let's review. Again, for dose for neck problems, you're generally going to be using anywhere from 10 to 25 watts of power. If you have our 40 watt unit, you can certainly move right towards 40 watts with these problems. You're going to get great results. But 10 to 25 on our FXI or the EXPI if you have that flexibility. And then for dosing, you're going to be looking at roughly 10 to 15 joules per centimeter squared for the dose. Want to be on the lower end of that if you have radicular complaints or an acute problem like whiplash, something along those lines, and go towards 15 if you have something that's more chronic. After you do a treatment and they come back 24 hours to 48 hours later, and you can get their feedback on how it went, then you can adjust things accordingly depending on what you hear. So hopefully that helps, and good luck treating next.